Hello, sir. Shall we start?
Yeah, please give the
Uh,
countdown.
Technical team, just give a final countdown.
Yes. Hello. Welcome to all of you for today's webinar. As you know, this is part of Venkat Academy's efforts to teach the subject of aesthetic dermatology systematically and scientifically as per the syllabus of Rajiv Gandhi University of Health Sciences. We have been covering different topics so far. We finished the subject of trichology, and we have one new topic this year, something which we have not covered in the previous 2 years, and that is the subject of nail cosmetics. Nail cosmetics has been of growing importance. People are seeking information and advice regarding nails, but generally there is nothing much that is taught or read about nail cosmetics. So we decided to include this just like we included the previous topic on hair cosmetics. And to do this webinar, we have Dr. Nitin, our fellowship student, and as our expert, we have Dr. Anirudh. Next slide, please. Dr. Anirudh is a consultant at our center. He completed his MD from Bangalore Medical College and got the top rank in the university. He also has done diplomate of National Board and also the certification from Royal College of Physicians. He completed a fellowship from the in the subject of aesthetic dermatology in our center only. He has contributed to chapters, and of course, he is a very keen academician. So I'm very happy that one of our fellowship students is now a consultant at our center and somebody who presented under this program some time back is now an expert. I wish him good luck and I hope to see more such work from him in future. Thank you, Anirudh. Thank you for joining us. We are very happy. So now the events are as follows. I will now hand over the mic to Team Gloderma, who have their some announcements to make, followed by a presentation by Dr. Nitin, and then a presentation by Anirudh, and then we'll have questions and answers. Over to Team Gloderma.
Thank you so much, sir. So, Venkat Center and Gloderma welcome you all for Venkat Academy Aesthetic and Trichology Knowledge Dissemination Series in association with Gloderma. Now, I would like to introduce Gloderma. The Gloderma spreading glow in the lives of millions through innovative technology. Gloderma have a pan-India presence, enterprising team of 500 plus professionals. Gloderma have a path-breaking innovative technologies and many first-time Indian brands. And Gloderma always trusted by dermatologists. Gloderma representative meets 10,000 plus dermatologists regularly, and Gloderma always spreading glow in the lives of 1,000 million Indians. Now, Gloderma have a product mix like antifungals, moisturizers, acne care, and hair care. Also, we have a psoriasis care, topical steroid, vitiligo care, and nutraceuticals. Gloderma have a Gold Impact Brand Award with a prestigious award by Pronto Consultant Consumer Award for OZX. Gloderma have a always patient safety is of a paramount concern. So, India's first company to make all product paraben free, sulfate free, and detergent free. Now I would like to introduce our flagship brand, that is Moist, the most advanced moisturizer and cleanser. In Moist, we have a Moist cleansing lotion, Moist LMF 48, Moist XL cream, Moist Syndet bar, and Moist cream and lotion. Gloderma launching an innovative range of transparent soap, that is a TSF technology, transparent soap formulation technology, which containing azurate soap, that is azelaic acid, and Kion soap that containing ketoconazole soap. We have a hair care range, that is alcohol-free minoxidil solution, Minoboost and Minoboost F topical hair solution with a 360-degree spray applicator and dropper. Gloderma launching first time in India a novel non-fluorinated topical quinoline OZX that containing ozenoxacin, and OZX available in cream and lotion form. Gloderma have a tie-up with the Sanosan Baby, which is made in German brand. Germany's premium baby skincare, trusted by mothers in 70 plus countries. Sanosan Baby, made in Germany, made with more than 90% natural ingredients. Sanosan Baby made with a chemical free, that is 0% SLS, SLES, paraben, phenoxyethanol, and silicone. Sanosan Baby clinically tested and hypoallergic. Sanson baby made with a milk protein and organo olive oil. All participants can download their e-certificate with a valid email ID. This is the e-certificate for lecture number 24. Please note, recorded version of Venkat series 1, 2 and 3, lecture 23 available on glowdermadigiConnect.com. Thank you so much. Now I would like to hand over this session to Dr. Nitin sir.
Is my screen visible?
Yes sir, yes sir.
Very good afternoon to everyone. Myself, Dr. Nitin. I'm a fellowship student at Venkat Academy, Bangalore. So at the outset, I would like to thank Venkat sir for giving me this opportunity, and also Dr. Anirudh for being my moderator and for guiding me towards the presentation. And also, I would like to thank Team Gloderma for their continued support. So today the topic is about nail cosmetics. So coming to the history, the earliest use of nail coloring it dates back to ancient Egypt and China. The first nail polish was made from egg white, flowers, and beeswax, natural henna, Arabic gum, and lavender oil, along with many other ingredients. So the artificial nails they go back to 600 BC to the Zhou dynasty in China, where nails were made from gold, silver, and precious stones. So and also the artificial nails were owned by noble women as a sign of status, and they were made up of gold, ivory, and gold. So in 1954, a dentist named Fred Slack, he created an artificial nail using his dental equipment and chemicals. So he experimented with the different materials and later he patented a successful version using acrylics and he started the company Patty Nails. So the modern day nail polish was formulated in 1920 by Charles Revson company, so which is today known as Leverer Law. So it also became commercially available in 1930. So coming to the brief nail plate anatomy. So the nail plate is a modification of the stratum corneum, which is a thick keratinized multi-layered structure which lies over the nail bed and the matrix. So the 15 to 20% of the nail plate it lies over the matrix and 80 to 85% lies over the nail bed. It frees itself from the nail bed at the distal onychodermal band. So the onychodermal band is an anatomical barrier which safeguards against the environmental hazards. The disruption of this band leads to onycholysis. So the nail plate it gains thickness and density as it glows distally. So the bulk of the nail matrix is formed by the germinal matrix. So the matrix it starts at the proximal edge of the nail and it ends at the border which corresponds to the lunula. The cuticle layer is a modified layer of the stratum corneum which extends from the proximal nail fold and attaches firmly to the dorsal aspect of the nail plate. So this is the diagrammatic representation. So this is the lunula, so the nail plate, the distal edge of the nail plate. So this is the cuticle. So when we see it in a sagittal section, this is the nail matrix, the nail bed, and the cuticle on the top, and this is the hyphenactive. So what is an attractive nail? So a nail is considered aesthetically pleasing. It has the following features. So it should have a smooth, glossy surface, no overhanging or ragged cuticle, a tip which extends beyond the nail, a oval contour to the nail plate, a gentle curve when visualized from the side, and translucency so that the pink nail bed is clearly visualized. So there are many types of nail cosmetics, which include nail polish and its variants, nail shellacs, nail hardeners, nail polish finishers and removers. And coming to artificial nails, which includes nail tip, nail wraps and modifications, sculpted nails, which include acrylic nails and gel nails, nail adornments, and nail moisturizers. So there are a few principles of nail cosmetics. So we'll see one by one. So first coming to adhesion. So this is an important step in nail enhancement. So the adhesion makes two surfaces stick together. And next coming to primer or base coats. These makes the surface of the nail plate more compatible and resist the peeling of the product applied. And it also improves adhesion and it requires a dry or a clean surface to act well. So the polymerization, which involves the application of a monomer and the use of initiator or energy sources for cross-linking molecules. So lastly, the evaporation, where the polymers are dissolved in the solvents which evaporate and the material hardens. So coming to nail polish, so nail polish also known as nail paint or nail varnish, it's basically a lacquer which is applied over nails for the purpose of beautification, strengthening and camouflage. It also improves water binding of the nails and also fills in nail patches. The key component is a quick drying lacquer which is derived from dissolving boiled nitrocellulose. So this nitrocellulose film, it creates a film which is oxygen permeable, so which is important to the nail plate length. And also there are secondary resins which are used to enhance the nitrocellulose plate. So finally the pigments are added to form the colored nail polish. So these are the various components of the nail polish which include the film forming agents, that is mainly the nitrocellulose and others like methacrylate polymers and vinyl polymers. and also the film forming resins which are used for adherence and they also prevent chipping of the nail. So the agents include formaldehyde, polyamide, and also toluene sulfonamide formaldehyde, also known as tosylamide formaldehyde resin (TSFR). And the plasticizers which keep the product pliable and also they prevent chipping. So they contain diethyl phytalate, dioctyl phytalate, and others. The solvents which dry quickly to lose the colored film behind on the nail surface. So various colorants are made which include organic and inorganic pigments and also mineral pigments like zinc oxide, titanium oxide, and synthetic pigments. So the thickening agents are basically the clay derivatives which are used for uniform suspension of the ingredients. And color stabilizers, these basically they prevent UV-induced color fading. So they contain benzophenone 1 and ectopyrin. So there are various other agents like guanine which are taken from fish scales, metal particles, titanium dioxide coated mica scales, and metal particles like aluminum, gold, and silver, and the right respective ingredients which give a pearl-like appearance. And also sometimes antifungal agents like cyclopyrox and avalolfin are used for therapeutic purposes. So there are various variants of the nail polish. So that is a photochromatic nail polish, which is a UV sensitive compound which darkens on exposure to sunlight. Thermochromatic, so the color change induced is mainly by the temperature. The lighter color when the temperature is cold and darker when the fingers are warm. So the magnetic, it basically contains an iron powder. So the magnet is the nail polish cap, which can be held close to the nail to formulate the iron powder in the desired pattern before the evaporation of the solvent. So whereas these type of nail polish should be removed before the patient is undergoing for an MRI. So breathable nail polish, these are usually water and oxygen permeable. KVR nail polish, these are small spherical beads which are pushed into the wet nail polish to give special effect. And hypoallergenic nail polish, so TSFR, that is tosylamide formaldehyde resin. So that is the big component of the nail polish, which is the common cause for allergic contact dermatitis. So to overcome this, they have used a polyester resin or cellulose acetate butyrate. So, but even for these compounds, there is some sort of sensitivity. So the toxin-free nail polish, it does not contain butyl phytalate, toluene, formaldehyde, and these are the ingredients which are not there in the hypoallergenic nail polish. But there is increased chances of peeling when we use hypoallergenic nail polish also. So coming to press-on nail polish, so these are self-adherent and a colored plastic film which can be fixed to the nail plate to stimulate the nail polish effect. So it is a very quick and easy method to dress up the nails, and it does not need a nail polish remover, but the weight and the durability is poor. So the nail polish application consists of 3 steps basically. So involve the application of the different coats and each applied with a 10-minute gap. The first step is the base coat, that is a transparent coat with high resin content for strong adhesion, so which prevents the nail plate stain. So the next is the nail enamel, which is a pigmented polish producing opaque film to beautify the nail. So this is the aesthetic part of the nail polish. Then comes the top coat, that is a polish containing sunscreen, which prevents the color fading and also adds shine and prevents removal of the nail enamel and also the chipping of nail. So finally, the dryer, that is a liquid which speeds drying of the nail polish by evaporation of the solvent. So there are something called as nail mending kit. So that is like any fracture to the free edge of the nail plate, it can be repaired with the application of the mending papers. So that are saturated with clear, thickened basic nail polish substance. So when dry, then the nail is repaired, then the conventional nail polish can be applied. So the damaged nail plate can be protected until the normal growth permits trimming and filing. So coming to nail shellacs, so this is a polished and a gel hybrid which uses polymerization photoinitiators and acrylate oligo or monomers along with the pigment from traditional nail lacquers. So they have 6 coating steps, each of which is followed by exposure to the light emitting diodes. So these resist chipping and can be worn out on natural nail plates. So these are usually thinner and less heavy than the gel nails and can be easily removed with acetone. So we'll see about nail hardness. So these are applied to strengthen the soft and brittle nails. So these contain formaldehyde, which acts by cross-linking keratin, but they also have the potential to cause paranoia and other complications. So the other ingredients may include nylon, titanium, silicon, zirconium, calcium, and wire. So nail polish finishes. So each finish of the nail polish contains special ingredients which will determine the surface appearance and also give a visual characteristic. So many nail polish finishes like cream, shimmer, matte, flat, translucent, various types of nail polish finishes are available. So coming to nail polish removers, so this nail polish can be removed by redissolving the resin deposited on the nail plate after the solvent evaporates. So the removers are applied with a tissue or a cotton ball, or they can be left on the nail and covered with aluminum foil. So acetone is the most used, but its frequent use can cause dry, lusterless nails and irritant dermatitis. So the acetone-free removers, they contain ethyl acetate and butyl acetate. So the nail polish removal pads, they usually contain gamma butyllolactone, which can rarely get converted to gamma hydroxybutyrate, which results in systemic toxicity and can dehydrate and damage the nail. So the nail polish removers, which come with fatty materials, lanolin, castor oil, and other synthetic oils, they can act as occlusive nail moisturizers. So, but in practice, they're not unable to overcome the dehydrating effect of the solvent. So coming to nail adornments, or basically we have to call as artificial nails. So these are also known as false nails or nail enhancements. So these are extensions placed to mimic the true nails or to have an artistic look. These artificial nails, they have versatility in size, design, shape, and can be placed over the pre-existing nails. So coming to the types of it, the nail tips. So these are preformed tips which can be pressed on or re-glued or unglued on the nail. So the preformed tips, they can be removed from the packaging and placed on the nail plate and can be held for a few seconds. And these can also be shaped and trimmed as desired. So this is how an artificial nail looks. So they come in various shapes and various attachments can also be made. So this can be easily removed and they only last for a short term, usually less than a week. So the traumatic removal can lead to onychosis, so that is the splitting of nails. So these are also not very flexible and can cause onycholitis. So there's something called nail wraps and its modifications. So the usually linen, fiberglass or silk, these are applied to the natural nail plate using glue, and over this acrylics are applied. So the nail wraps, they produce strength to the nail. So sculptured nails, so these are custom designed nail elongations that fit according to the individual requirements. So these require a mixture of powder and a solution that is applied over the natural nail. In acrylic nails, so it is usually a monomer like ethyl methacrylate is mixed with the powdered polymethyl methacrylate polymer using benzoyl peroxide as an accelerator for the polymerization. Hydroquinone or monoethyl ether of hydroquinone can also be added to slow down the process of polymerization. So a template of foam is usually placed on the natural nail and a new nail elongation is built over it. The powder mixture can also contain additives like colorants. The acrylic ceramic hardens in 2 to 3 minutes, after which it can be shaped, buffed, or covered with the nail polish. So this process of polymerization is fully complete in 24 to 48 hours. These acrylic nails can be removed with acetone and can last for 3 weeks or longer with touch-ups. So usually how it is applied, usually a brush is dipped in liquid monomer and then it is usually passed over the polymer powder to form a small bead, which is then applied over the natural nail plate. So 3 to 6 beads are brushed per nail plate. This is how it looks finally. So coming to gel nails, so gel nails, they require UV light for hardening after application, which takes about 1 to 3 minutes. The UVA lamps or light emitting diodes can be used for photo curing. So the gel nails are composed of urethane acrylate oligomers, cross-linking monomers, photoinitiators, and catalysts. So they are applied in sequential coats, usually three in number, and also after each coat, the photo curing is done. So in the final steps, the nails are cleansed and the shaping is done. So gel nails have high gloss finish, more aesthetic appearance, and have more strength, and they usually do not chip. So the removal requires buffing, which on repetition can cause nail plate thinning. So the touch-ups are required every 3 weeks as with the nail growth. And also approximately at the nail, there is usually a gap which occurs. This is how a gel nail looks. So coming to nail artifacts, so these include multiple stickers like color strips, jewels, or metal artifacts, which can be applied immediately before the polish dries and in various patterns followed by a top coat. So the nail designs can also be made after the first layer by making a design with a template in a different color. So nail moisturizers, so these help with the dry, brittle nails and are usually creams or lotions. So they can contain occlusives such as petrolatum, lanolin, humectants, and such as glycerin and propylene glycol. Urea and alpha hydroxy acids can be added to increase the water binding capacity of the nail plate. So these work better if they are applied under occlusion at bedtime for at least 3 months. So come to the nail grooming procedures, usually that is the manicure or the pedicure. So these usually involve the cleaning, shaping, and application of nail lacquer or artificial nails over the fingernails, that is known as manicure, and the toenails it is known as pedicure. Come to the steps. First, the hands or feet are soaked in warm water with soap to remove any debris and soften them. So the rough skin and thick calluses are buffed. Then the nails are trimmed and filed to get the desired shape. So the nails are shaped with no modification of corners to prevent ingrown nails. Then a cuticle softener containing sodium and potassium hydroxide, quaternary ammonium compounds with urea is applied for 5 to 10 minutes. The cuticle is then pushed back using a metallic stick and trimmed. So the surface of the nails are buffed with an emery board for a smooth appearance. Then the hands or feet are dried and the emollient cream is applied and massaged to soften the skin. So application of the nail lacquer or the artificial nails comes to the last step. So in French nail manicure, it gives a natural appearance to the nail. So in this, a white color is applied at the tip and a pink color is applied at the nail plate to give the appearance of a healthy, unpainted nail. So after following all the basic steps. So other two types of manicure, it mainly depends on the final product applied. The initial basic steps remain the same. Others include it can be a shellac, gel or acrylic manicure, paraffin manicure, and dip powder. So in Vinylex there is no base coat, so and which allows it to strengthen with natural light, and also there is a long lasting effect. So coming to the adverse effects of nail cosmetics, can be classified into those related to the procedures and salon services and due to the products like nail polish and artificial nails. So there's something called contact sensitization, which is mainly because of the cosmetic products used. So it can present as onychodystrophy, onycholysis, paronychia, or as dermatitis on other cutaneous sites. Some rare side effects include bacterial endocarditis as a consequence of pedicure, candidal osteomyelitis, and discitis. There was a case of pneumothorax and respiratory obstruction in a 15-month-old child due to accidental sucking of the nail polish or patch. And also there is complications like pterygium inverse or longus, and also non-melanoma skin cancer has been noted. So these are the various complications which occur due to the nail salon procedures. So these are mainly due to the macro and microtrauma. So that is mainly onychosesia, thinning and brittle nails. So as a result of the clipping of the nails when they are dry and during the removal process. Apollonychia, that is the weak foldable nails due to excessive filing, drilling and buffing during the procedure. Onycholysis mainly can occur because of repeated manicure or pedicure and a lot of probing under the nails. So various infections like viral infections like warts, herpes, and fungal infections are mainly candida and dermatophytic. Then bacterial infections mainly due to the pseudomonas bacteria and also mycobacterial infection can occur. So as these infection mainly occurs because of the cuticle cutting and probing under the nails, and also if there is any improper sterilization of the equipment, and also there is improper cleaning of the pedicure footballs. So the nail plate thinning can occur due to over hydration due to stick-on dressing. And also there is transverse leukonychia which can occur due to repeated microtrauma during the manicure. So these are adverse effects, mainly the contact dermatitis. So mainly because of the ingredients like nail polish, the positive allergen mainly involved is nitrocellulose, formaldehyde, and tosylamide formaldehyde, the most common. In nail adhesives, it contains like methyl acrylate, acrylic nails again methyl acrylate. In gel nails, mainly because of the photobonded gel nails, and also in nail hardeners, again formaldehyde is the culprit. So onycholysis mainly occurs with the nail polish. Again, tosylamide formaldehyde is the culprit agent. Also, it can occur in acrylic nails and also in gel nails and nail harness. So paranoia again due to nail polish agents, cuticle removers when we use sodium and potassium hydroxide and also in gel nails. So these are few adverse effects. This is onychosesia following the frequent use of the nail polish remover. You can see the remnants of the nail polish and also the splitting of the nail. So this is distal onycholysis due to constant probing under the nails, and this is a complication in the right toe, the green thing, mainly because of the pseudomonas bacterial infection. And also there is whitish keratin degranulation in the left toe. So again, ACD due to the various cosmetic ingredients used on the nail. And this is a case of contact vitiligo due to gel nails. So mainly along the proximal and distal aspects of the fingers. So what is the relevance of nail cosmetics in a healthcare setting? So usually long fingernails, they harbor bacteria and agents like antimicrobial soaps or gels, they may not be sufficient for the complete elimination. So also the long nails are cumbersome as they reduce the grip and also they tend to puncture gloves. So therefore these are best avoided by medical professionals in healthcare settings. Wind data in his study on 102 perioperative nurses concluded that chipwood nail polish or nail polish worn for more than 4 days, they increase the bacteria on fingernails. And also opaque nail polish can mask nail signs during a clinical examination. So few patient-related information on safe use of nail salon and nail cosmetics. So whenever the patient should go to the salon, so these things should be kept in mind. The nail salon should be clean and the staff should be well attired with clean nails. So also ask about the sanitation and sterilization of the salon. Check the nail equipment whether it Chemicals also should not be excessively pushed back and nail plate should not be overworked. So the nail place or nail polish or the artificial nail should be applied carefully so as to not enter the proximal nail pore, which can cause damage to the nail matrix. So also the nail extension should be kept short and nail polish should be only left over a few days and should not be layered over the old one. And it should be removed with an acetone-free cleanser. If there is any nick or cut which has occurred during the procedure, immediate medical attention should be sought. And also, patient is advised to wear gloves with wet work whenever they have undergone a manicure, so as to protect the manicure. And any itching or burning after the service, it can indicate a reaction and needs medical care. And seeking medical attention should be sought if there is any swelling, pain, redness, and the growths are any particular growths are present around the knees. These are my references. Thank you.
Hello. Okay, thank you. Thank you, Nitin. This is a somewhat unfamiliar topic. So I see that you have put in good effort to prepare this presentation. Thank you. Now I request Dr. Anirudh to start his presentation.
Yes, sir. Is my presentation visible?
Yes, sir.
Okay. So before commencing, I would like to thank Dr. Venkatram sir for giving me this opportunity and also Team Gloderma. So Dr. Nitin has elaborately covered about the nail cosmetics that are available commonly, the principles of their usage, their chemistry in detail, and also the nail grooming procedures that are done frequently, and also the safety tips for all those who are getting these nail cosmetics done. So I'll be focusing mainly on the practical aspects and the usage of these nail cosmetics in nail disorders. So let us touch upon the origins again. The oldest evidence of nail care was from Egyptian mummies 5000 BC ago. It was found that the fingertips were dyed with henna. And Nefertiti and Cleopatra, these are not unfamiliar names in the history of aesthetic cosmetics, where they used henna and herbal tonic extracts to color their nails. And these colors, they reflected their high social status. And there used to be semi-precious stones that were adorned in that. And there have been indigenous nail art practices from Africa, which used henna, beading, painting, plant and clay art designs. These arts were not only for decorative purposes, but had different socio-cultural symbolisms, their tribal affiliations, and for females, their marital status, warrior experience for the males, and also social hierarchy. If you look at a reference at our Indian history in ancient India, so these are some really interesting pictures from Chennakeshava temple located in Belur, Karnataka. So these observations were made by a famous YouTuber. So in this, we can see in the first picture, there is an elongated nail plate from a female character which has been sculpted. So the nail plate is extending beyond the nail bed, and there appears to be a nail fold which doesn't look like a natural nail fold. So this could be an artificial nail. So this was in the era of Hoysala dynasty, which they ruled from 1000 AD to 1346. So maybe that was the social norm among the females in that era, and the sculptors have captured it in their sculptures. So if you look at the current scenario, the current global market for nail care products is estimated to be at around 20 billion US dollars. And according to a Guardian article, the hashtag nail has been used over 151 million times on Instagram. And there has been online marketing and new businesses which boomed up during the lockdown period. And in the last decade, there have been mushrooming of these nail studios and manicure bars, and celebrities and social media influencers promoting the brand and setting the trends. So the popularity of nail cosmetics has definitely increased. So what is the role of a dermatologist now? So the dermatologist should be aware of the nail care products that are available and the grooming procedures that are being done by the beauticians, and should be able to identify the adverse effects due to these cosmetics or procedures, and should be in a position to give advice regarding a safe usage of these nail cosmetics, and should be able to understand the cosmetic needs in diseased nails as well, so as to use them where and when required. The nail camouflage serves as a temporary relief in untreatable or disorders which require a long-term treatment. So attributes of an attractive nail have already been discussed. The whole idea is to give an illusion of long, slender fingers or toes. As the stout fingers are represented, they are not found to be more appealing and represent ape-like features. So many of the females, they seek this kind of illusion of a long, slender fingers. So the nails have to be oval, glossy, and the tip should extend beyond the nail with no overhanging cuticles and no corners. So nail disorders, they include all the abnormalities that affect the nail unit. So these can be associated with the dermatological disorders like psoriasis, lichen planus, or systemic disorders, or due to physical agents such as UV radiation, infrared heat, or due to environmental agents like chemicals or drugs, or due to microorganisms, bacteria, fungi, and some of these may be due to aging changes and also due to mechanical trauma. So, what are the indications of nail cosmetics? One is to disguise the nail abnormalities, and it has also been used to break the habits of tics in children, so like nail biting and cuticle biting. So, it can be used to manage fragile nails and to give a youthful appearance to hands and to also maintain the nail hydration. So let us see some of the morphological changes in the nail plate. One is the alteration in nail surface. The most commonly that we see is nail pitting. Next is diffuse lines. These are transverse ridges which correspond to the periods of nail interruption in the nail growth due to some illnesses. And tracheonychia, which represent the rough surface and longitudinal ridging in a nail plate. And onychorhexis, which is the longitudinal breakage or fracture of the nail plate. Then there can be alteration in the nail shape and size, like increased curvature as seen in clubbing, and a thickened nail plate as seen in pachyonychia and onychogryphosis. And plateonychia and coelonychia, they represent flat nails and spoon-shaped nails. And sometimes there will be developmental disorders with no nails known as anonychia. And the acquired cases are maybe due to trauma or any severe dystrophy. Then there can be alteration in the nail plate or the nail bed adhesion, so which is known as onycholysis, the separation of nail plate from the nail bed, which can be associated with subungual hyperkeratosis and onychomedesis. Onychomedesis refers to proximal separation. Then there can be alteration in the nail color, such as erythronychia, leukonychia, different types of leukonychia, and melanonychia, and nail discoloration due to subungual hemorrhage. So all these can be dealt with nail cosmetics where and when required, along with the definitive treatment with pharmacological agents. So the whole idea of cosmetics and camouflage has different facets. And for cosmetics, the meaning lies in enhancing the beauty of already healthy nails. Camouflage is for to cover up the diseased nails along with the pharmacological treatment, which is the definitive treatment. Regeneration when there is a reversible damage to the nail plate, and reconstruction when there is irreversible damage. And rejuvenation is for age-related changes and other minor insults which occur to the nail plate. So all these constitute the help in beautification of nails. So today the stress is on cosmetics. So in nail disorders, the disfigurement of nail plate definitely reduces the quality of life, and all these disorders require longer duration of treatment, and cosmetic camouflage is really help during that period till the therapeutic response is achieved, and reconstructive procedures are to be carried out in other developmental disorders. So if you look at nail polish, they can be used in dyschromias and mild dystrophies. So in a nail polish, the base coat fills in the irregularities of nail plate and provides a neutral color, which acts as a starting point for the pigmented nail polish. The top coat adds gloss to it and prevents premature chipping, and acts as a protectant, and also prevents contact with allergens and detergents and water, and slows down the evaporation from nail plate and enhances the nail moisture, thus enhances the beauty of the nail. Similarly, nail hardeners can be used in case of soft nails, onychosasia, or poorly formed nail plate. It is a modification of nail polish with a different solvent and resin concentrations, with the addition of keratin, calcium chloride, nylon fibers, Teflon, and silk, and is used as a base coat to strengthen the nail plate. Nail mending techniques, as already described, helps in repair of just minor splits and fractures at the free edge of the nail plate by sticking a small piece of the mending material, which could be a paper, fabric, or a gel. So the base coat of nail polish is applied on top of that, followed by application of a colored enamel and sealed with a clear top. So this not only prevents further damage, but also helps in covering up the already damage, which is made. Sculptured nails and artificial nails, which have been described, help in covering up moderate nail dystrophy. Sculptured nails have a more natural aspect as they are molded over the natural nails. So the growing nail plate can sometimes create a gap between these and has to be filled to maintain the appearance of these sculptured nails. So these also can be taken out easily by soaking in acetone. Nail prosthesis, as I said, when there is irreversible damage because of trauma or any other infective condition, when there are deformed nails or anonychia, complete loss of terminal phalanx. So nail prosthesis is an option. Here, the finger, which is made of silicone rubber, is fitted over the finger stump and cases the distal phalanx completely. This silicone rubber finger is fine and flexible and hence maintains the pulp sensitivity. So this also has the same markings and colorings as finger to simulate a natural finger. And nail also can take up the nail polish or varnish. So this is how it is done. So nail tattooing is another form of camouflaging, so which is a joint effort of a physician and a tattoo artist. So it helps in achieving this 3D appearance of nail bed and nail plate. The shape and color of nails being decided prior to the procedure should match the complexion of adjacent nails. So series of small dots are applied superficially in the papillary dermis to give this 3D appearance of nail plate. So this is one of the published report where the lady had undergone complete nail avulsion for onychocryptosis, following which the tattooing was done, which gave an excellent result. So nail peels, here their role is in improving the nail, superficial nail abnormalities for dry nails, rough nails, trachonichia, mild trachonichia, discoloration, and hyperkeratotic nail plate in some of the infective and allergic conditions. So the effect of these nail peels depends on the depth of discoloration. If the discoloration is too deep, then these will not help much. So the peels will overall give you a smoother appearance of nail plate and helps as a quick rejuvenation till definitive results are achieved. So also, these enhance the effect of nail cosmetics. The only thing is that during the procedure, the integrity of cuticles has to be maintained and the procedure has to be done carefully and used cautiously in case of infective conditions such as onychomycosis. So these are a few studies. So they have used glycolic acid in a concentration of 50 to 70% for inflammatory nail diseases. So this is a well-tolerated modality for superficial nail plate abnormalities, so which are caused by either due to mechanical or chemical inserts. Then PRP for nails. So this is another topic which comes under regeneration of the nail matrix. So there has been a review on this, and there are hardly 2 or 3 studies which have been taken place. So these studies included PRP either independent alone or in association with triamcinolone as an intramatricial injection. So the authors have reported good results with this, and but the procedure is quite painful and has to be considered as a last resort. And in case of idiopathic trachonichia, maybe this regenerative procedure may help. Then if you look at some of the adverse effects, paronychia results from poor manicuring skills and use of electric files, poor disinfection measures, and ridging and leukonychia can be again due to these nail grooming procedures. If overzealous manicuring is done in the vicinity of lunula, and if high pH cuticle removers are used, then this can lead to ridging and leukonychia. There can be discoloration due to these cosmetics due to leaching of dyes from the nail polish. White spots can be formed if the coverings and coatings are removed forcibly. And onycholysis can also occur due to aggressive manicure, use of pointed instruments and electric files. And if the attachments are excessively long, and use of preformed nails can sometimes cause thinning of the underlying natural nail plate and cause separation from contact with the methacrylic acid, which is used as a glue for nail wraps. Pterygium formation, which occurs due to cutting of eponychium, which leads to sticking of the proximal nail fold to the nail plate and forms a transparent band. Sometimes there can be bluish yellow discoloration of the nails due to formaldehyde preparations. And also, pain and hemorrhage have been reported with formaldehyde preparations. There is a report of pseudo-psoriatic nails due to contact allergy to methacrylate, and also can be due to mechanical trauma. So this leads to diagnostic dilemma whether it is nail psoriasis or due to allergic contact dermatitis, which mimics nail psoriasis, subungual hyperkeratosis and pitting. So the cause-effect relation has to be established in such cases so that the exact etiology is not missed. Now coming to allergic contact dermatitis and distant reactions. So nail cosmetics rarely cause eczematous, localized eczematous contact dermatitis, but they are known to cause ectopic dermatitis.
Hello?
Hello?
Ah. Hello?
Hello?
Ah. Completed?
Yes, sir. Few slides. So this can lead to patchy eruption on the eyelids, ears, neck, and
No,
genitals and
sorry,
deltoid.
1 minute. The presentation disappeared from my screen. That is why I asked.
Hello?
Can you hear me?
Hello?
Yes, sir. Yes,
Am I
sir.
audible?
Yeah, you are audible. The presentation disappeared,
So
Anirudh.
which can be, sir, maybe poor connection. Hello?
Your presentation is
Sir,
not seen, Anirudh.
sir, I guess Aniruddha sir left. Yeah, he is coming.
Hello?
Sir, you are audible,
Hello?
sir.
Yeah, okay. So these allergies can be found in
Sir,
distant
please share
sites
your
such as,
screen.
okay, sorry. Is it visible now?
Yes, sir. Yes, sir.
Yes, sir. So these can occur at distant sites such as eyelids, the face, neck, back, anogenital region. The common allergens, as described by Dr. Nitin already, it can be due to wet enamel, nail hardness, cuticle removers, which are alkaline in nature, and also because of the acrylate polymer present in these gel nails and artificial nails. So this is the list of a common allergen formed in each of these nail enamel component. Can be usually formaldehyde, nitrocellulose, or solvents like toluene, alcohol, even colorants and heavy metals like bismuth can cause these kind of allergies. So coming to the management of allergic contact dermatitis, the test battery should contain some of these common allergens: formaldehyde, nickel, nitrocellulose, and resin mix, colophony. So these are components of standard patch testing battery as well. So this can be tested with standard patch testing. So the main allergen in nail enamel is formaldehyde, and it can also be because of nickel, which are used as mixing beads to maintain the liquid state of the nail varnish. And patch testing of the nail lacquers can be done as well. So hypoallergenic nail enamels are recommended in this case, which contain polyester resins instead of this formaldehyde resin. But even those can cause allergies. So there is no guarantee that they will not cause allergies, but companies are marketing them as hypoallergenic. Now coming to this topic of UV nail lamps and reported malignancies. So low intensity UVA light is used to cure certain these nail gels. So these are applied on the nail layer by layer, and the UVA light is given for around 10 minutes. So these gels are preferred over natural nail polish as they are of superior adhesion, durability, and have crack resistance. So the first observation was made in 2009 with the occurrence of non-melanoma skin cancers in hand by McFarlane et al. And following which there have been commentaries and letters on the same topic from 2010 to 2020. So there have been mixed opinions. So currently the recommendation is to use a fingerless glove and also apply nail sunblock to the entire hand while taking this UVA treatment, and also to cover the eyes as well. So cosmeceuticals serve as a supplement when treating nail dystrophies. So especially biotin in a dosage of 2.5 to 10 milligram per day helps in improving the lipid synthesis and keratinocyte binding. Vitamin E as an antioxidant helps in recovering the nail structure. Cysteine helps in growth of hyponychium cells and promotes the hardness of nail. Calcium and iron and zinc also help in improving the nail quality. So these can be used as adjuvants. So some of the highlights of this topic. So nail cosmetics is a growing market with the changing trends and common products and procedures, and their known possible adverse effects, including allergic contact dermatitis, should be well known to the physician, and the relevant advice should be given on usage of right techniques and products. And nail camouflage, the importance of nail camouflage should be reconsidered. So it is a great alternative during slow treatment outcomes and helps in improving the quality of life of patients. So nail rejuvenation procedures can also be undertaken as a short-term measures wherever indicated. So thank you everyone for your patient listening. That was my time.
All right. Thank you. Thank you very much. Some very interesting topics, some very interesting ideas. Let us look at some questions. Before that, Nitin, do you want to ask a question to Dr. Anirudh?
Yes, sir. I have one question. The nail polish, the duration, can it be left for a longer time, or is there a certain duration then it has to be removed from it? Is there a specified duration?
So there is no specified duration, but the normal nail enamel polish contains nitrocellulose as a film producer, so which will crack up in 3 or 4 days. So it has to be repeated again, 3 or 4 days.
Any other question, Nitin?
So mainly this one, sir. So it can be used as a top-up as and when required.
Yes, yes.
Okay, now there are some questions in the chat box which we will take. Is moise suitable for emollient use in contact dermatitis cases? I do not know how this question is related to today's topic, whether it's a dermatitis or is it due to nail. Anyway, now are there any nail-specific moisturizers, Dr. Anirudh?
So these nail moisturizers mainly contain glycerol, sir. These are hygroscopic substances, and occlusives like petrolatum. So that mainly these class of moisturizers are used.
What about urea?
Urea in lesser concentration can also be used as a moisturizer.
Yeah, I think so. I agree with
Yes,
you.
sir.
Now, what safety precautions do you advise to patients who are visiting nail salons?
So nail salons, sometimes there is cross contamination. So it's advisable for who are visiting to carry their own instruments, these manicure instruments, and to be aware of the barriers of the nail unit, such as the hyponychium and eponychium. So these are doorways for infection, and there are some steps in the manicure procedure which help in pushing, which involve pushing the cuticle and excessively trimming the cuticle. That should be avoided.
How to manage cyanoacrylate containing glue spillage over the nail?
Yes, sir. Many cases have been reported which have caused burns in pediatric patients, especially. So the cyanoacrylate glue is dissolved in this acetone solvent. So whenever this comes in contact with the surface, the solvent evaporates and there is an exothermic reaction which takes place. So you feel that heat, and there is polymerization and hardening of this glue. So whenever such incident happens, if it happens on a normal skin, then acetone can be used to dissolve, but even acetone can damage the skin. So importantly, it has to be moisturized immediately, or otherwise, so it has to be left to dry up, and warm water can be used to release the glue. And if it is on sensitive areas, then have to be constantly washed with normal saline of water.
Now, there was one interesting slide that you put, which
Yes.
said that psoriasis-like changes were seen after exposure to a particular nail cosmetic.
Yes,
So
sir.
now, sometimes we see patients presenting with isolated nail abnormalities.
Yes,
One
sir.
nail showing some pit or some roughness or some ridge formation. Do you think we should be looking at contact, not exactly dermatitis, contact reactions causing nail changes in such cases? Should we be looking at more in those cases?
So, with respect to nail cosmetics, then the cosmetics are they do come in contact with all the nails of a person. So these kind of reactions may occur in more than one finger. So basically, the cause and effect relation has to be established in such cases, and with a meticulous history. So maybe if a single nail is involved, can consider trauma and other causes as a etiology rather than contact allergy.
Do you think patch testing is of any use in such cases?
So most of these components of nail cosmetics, the standard battery what we use for patch testing, these include all these. There is a resin mix, there is formaldehyde and colophony, everything which are used in the nail cosmetics, so which may be of help, sir.
I think that's an important point to take, that we should look at these nail changes for which there is no apparent cause. We should look at their possible causes, nail cosmetics, and then patch test them. So I think that is an important issue that we should look at. But otherwise, in terms of prescription items, apart from moisturizers, of course, we have steroid and other things. We have a limited option. So do you
Yes, sir.
think that any of the lasers can be used to treat any of these
Yes.
nail changes?
Yes, sir. In cases where the exact cause is not established, to ascertain the exact cause, most of these they have to be nail should be, or the entire nail plate has to be biopsied. So instead of doing that, so there have been nail rejuvenation procedures like chemical peels, and also fractional lasers have been used, fractional CO2 laser especially in case of idiopathic nail dystrophies, that have given good results.
Yeah, definitely. That is something good. So now, if there are no other questions, we have come to the end of this webinar. A rather difficult topic, unfamiliar topic. Thanks for dealing with this, Dr. Anirudh. Thank you, Nitin, for
Thank you,
preparing
sir.
this
Thank you.
presentation. Thank you very much. I hope that this effort has been appreciated by the delegates. Now I hand over the mic to Team Gloderma for their final announcements. Thank you.
Thank you, sir. Thank you, Aniruddha sir, and thank you, Nitin sir, to giving a fruitful information on nail cosmetic. Now, stay tuned for next lecture, which is on 8th May 2024, and the lecture is on melasma. And expert for this lecture is Dr. Rashmi Sarkar, and presenter is Dr. Fatima. All participants can download their e-certificate with their valid email ID. This is the e-certificate for lecture 24. Please note, recorded version of Venkat series 1, 2 and 3 is available on bluedermadigiConnect.com. Thank you so much everyone to joining with us. Thank you so much.